I think the viewers by now would have understood that since it is not one disease that I'm talking about, there cannot be a universal treatment or the same treatment to all patients. So it would not be appropriate to offer the same treatment to every patient. So naturally, it is very important to arrive at a diagnosis. Now there is a subgroup of immune deficiencies which are milder ones. For example, the IgG subclass deficiencies, wherein often giving them long-term antibiotic prophylaxis helps these patients. But this is a small subgroup. Now there is another group of disorders. These are B cell group of disorders. The examples being X-linked agammaglobulinemia, the common variable immune deficiency. These patients need immunoglobulin substitution. They don't have immunoglobulins in their body, so we give them immunoglobulins intravenously every month. Only challenge is we need to give them every month for the whole life. So this is monthly immunoglobulin substitution that is being done for a subgroup of these patients. Now, the most serious immune deficiencies like the SCID, the leukocyte adhesion deficiency, the chronic granulomatous disease, these patients need a bone marrow transplant. Now, bone marrow is the source of all blood cells in our body, including the white blood cells. And if you can replace the bone marrow with a healthier bone marrow from a donor, then you can cure these patients. So, bone marrow transplant can be curative in a majority of these conditions. To perform a bone marrow transplant, I think the most crucial factor is to get a match. And we always look for something called a 10 by 10 HLA matched donor. Now, the first source for us to look for the donor is within the family. So, the siblings of the child who is affected, if the siblings are unaffected, we do an HLA typing, and there is a good chance of picking up a donor here. I would say theoretically 25% chance of having a full match 10 by 10 donor within the family. Now, if we don't have a donor in the siblings, we look at the parents, the father and the mother. Often these parents are half match, what we call the haplo match, but occasionally they can be full match and we can choose them as the donor. Now, the final situation obviously is to go out to a registry. Now, if you need a blood transfusion, you go to a blood bank, isn't it? In the same way, there are registries called bone marrow registries, and we approach those registries and apply for the registries and ask them if they have a donor that matches the HLA of our patient. Since the registry size of Indian registry at present is smaller, it is often difficult to get a donor, I would say. The success rate could be somewhere between 10 to 20%. But then as awareness increases, because we all can become donors and there is no harm or no side effect. So as the pool size of the donors increases, the chances that we'll get a full match donor from the registry will also go up.